Hi, welcome to the Avaaz podcast. This is a podcast by South Asian women for South Asian women. And before we get started, I want to introduce you to the team behind this passion project.
Hi, I'm Dr. Madhu, and I'm a family physician, and I've been working largely with the South Asian community for over 25 years.
And I'm Dr. Nav. I'm an emergency room physician, and I also spend a lot of time working with South Asian community as well as other communities. And I also, like Dr. Madhu, have been in practice for over 25 years.
Hi, I'm Dr. Tithi. I'm a hematologist and oncologist. That means I'm a specialist in blood diseases and in cancer. I work in a specialized cancer clinic for over 22 years, and I treat a wide variety of patients, including South Asians.
And I'm Roop, the moderator and the non-doctor of this Avaaz podcast. And we're here to talk about issues that affect people of our demographic, so our age group, our gender, and our South Asian culture. Because there's a lot of things that we don't talk about when we have conversations with each other. And those topics do need to be given a voice. And frankly, that's the reason we call this the Avaaz podcast. Avaaz means voice. And we want to give a voice to those issues that we think are deservedly require our attention. So we've been together, the four of us, for about 20 years as friends, and some of us have known each other even longer.
That's right. Is it time for the great reveal?
I think finally, yes.
So that is that two of us are sisters. Roop and I are sisters, so we've known each other for a little longer than 20 years.
And as you continue to view and listen to the podcast, perhaps you guys can figure out who the older, bossier sister is.
This is our fourth season. Our first 3 seasons were audio podcast only. This fourth season, we've decided to embrace video to provide more accessibility to our audience so that they can view our episodes on YouTube, Facebook, and TikTok.
There's a lot of collective experience in this room, and I'd like to just share with you why we started the Avaaz podcast. During the COVID pandemic, we noticed that there were a lot of resources available about COVID and other things, but the information wasn't reaching our South Asian population. And so we wanted to provide a means that's more accessible to the South Asian community.
Yeah, as Dr. Madhu said, we found that our community wasn't really getting reputable or professional medical advice, either on the pandemic or other health topics, in a culturally relevant or sensitive way. So we decided to put our brains together and come up with an easy, accessible way to get the information for things that we don't talk about necessarily, but we should. And that includes a wide variety of topics, including menopause, PCOS, diabetes, and many more.
So there's lots to listen to. So please tune in regularly to the Avaaz podcast. You can find us wherever you listen to your podcast, Spotify, Apple, you name it. And please check out our Instagram channel at Avaaz_voice. Listen, like, learn, and please share the podcast with your friends so that we can continue to share this information. Thanks for listening.
Thank you.